Welcome to Integrated Strategies for Worker Safety and Health, a conceptual model for intervention and research. We're glad you're here. My name is Angie Hunt, Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to WWDPI. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with the Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week along with the slides. You'll be emailed the direct links for all of these items when they are available. As I mentioned, my name is Angie and I'll be moderating the webinar and Q&A session. Our presenter today is Professor Gloria Sorensen with an introduction by Cha-Cha Chang of the National Institute for Occupational Safety and Health. And now I'll hand it over to Cha-Cha.
Hi, thank you so much. Today I am very glad to be here. As Angie said, I am with NIOSH, the National Institute for Occupational Safety and Health. We are part of the U.S. Centers for Disease Control and Prevention, the CDC. Within NIOSH, I am in the Office for Total Worker Health. The Total Worker Health approach has a long definition, which Dr. Sorensen will share. Basically, we champion a systematic and integrated approach to worker safety, health, and well-being. We particularly emphasize organizational interventions that prioritize opportunities upstream so that we can enhance worker well-being for the entire workforce population as a whole, not merely one person at a time. This is more important than ever, given the changing nature of work, the contingent workforce, shift work, the aging population worldwide, as well as rising healthcare costs. You can see that there is much overlap with the interests of the Work Wellness and Disability Prevention Institute to create healthy workplaces and prevent disability, focus on work ability, and return to work. We really appreciate the Institute for sponsoring this webinar. We also thank you for joining in today. We know that there's a wide diversity of professionals that have registered for today's webinar, and that really fits with the Total Worker Health framework, which is all about breaking down silos and bringing everyone together to reach a common solution that is enhanced worker well-being. One of the activities we are most proud of in the Office for Total Worker Health at NIOSH is our support of 6 extramural centers of excellence, which conduct multidisciplinary research, outreach, education, and evaluation activities. Our speaker today leads one of these centers. Dr. Gloria Sorensen is Professor of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health and Director of the Center for Community-Based Research at the Dana-Farber Cancer Institute. She also leads the Harvard Chan School Center for Work, Health, and Wellbeing, the NIOSH Total Work Health Center of Excellence. Her research focuses on integrated approaches to worker and worksite health and safety, and has included intervention studies across a range of industries, such as manufacturing, construction, healthcare, social services, transportation, and in large and small work sites. She also has ongoing worksite tobacco control research in India. So thank you so much, Gloria, for this webinar. I'll hand it on over to you.
Thank you, Cha-Cha, and thank you also, Angie, for being our host today. We really appreciate the opportunity to be here, and welcome to all of you who are participating in this webinar on looking at integrated strategies as a place or an approach for promoting and protecting worker safety and health. I'd like to introduce to you our conceptual framework and provide some of the evidence base that we've been exploring within our research. And so I'm hoping that as we start today, we're kind of here with a common goal, and that goal is aimed at protecting and promoting worker safety, health, and well-being. And I appreciate very much that each of you are representing different perspectives as we look at this shared outcome. And I hope that as we get into our conversation today, we can actually explore some of the diverse perspectives represented in the audience. Today's objectives are listed here. We're going to address a few questions, starting out with what are we talking about when we mean integrated approaches for worker safety, health, and well-being? Why do we even want to take this approach? What's the value added for organizations? What's the evidence base that it will actually work? And what are some recommendations and resources in terms of how we might implement this integrated strategy? So we'll try to touch on all of these issues. But let's start, first of all, with some background. This slide here illustrates a standard model for worksite health promotion and protection. And we often see these different functions situated in different spots within an organizational setting. So for example, there might be a department or a function within the organization that's really fostering issues around health promotion, such as promoting healthier behaviors. It could be environmental supports like tobacco control policies, or maybe healthier foods in the cafeteria and vending machines. It could also be educational programs like weight management or screening services, or even flu shots that might be provided. Secondly, we may see efforts around work-related illness and injury. That might include ergonomics. It could include an occupational medicine clinic or safety measures within the workplace. All right, so at any rate, these are functions that are oftentimes situated in different places within a work organization. So the usual approach may be somewhat siloed, with a focus particularly on some of the downstream outcomes. For example, as Cha-Cha mentioned, these are approaches that often go individual by individual and may sometimes result in lower participation rates, particularly participation that maximizes participation among people who may already be healthy, but may have less benefit for people who may be most at risk for poor health and safety outcomes. So what we're trying to move toward is a more optimal approach that looks at this from a systems level approach, more collaborative across these different organizational components rather than a siloed approach, and actually begins to address some of the upstream root causes of some of these downstream conditions that we look at. This then takes a population-based approach rather than going individual by individual, and hopes to really provide increased work engagement among workers that might actually contribute to improved participation rates. So what we're trying to move toward is this kind of more optimal sort of a setting. So we might want to just stop here, and for each of you, consider, where do you see your own organization as sitting on this kind of continuum that we've outlined? And this is certainly not a dichotomous piece, and we recognize that different organizations may fall in different places and actually may be picking up some aspects of an integrated or systems approach, and maybe in other areas not so much. So think about this as we go forward in terms of your own organization, and we can come back to some of the questions related to this as we get into our later question and answer period. So as we look at this, we're picturing this as a new paradigm within what we think of as an integrated approach or within total worker health. And it starts by really saying, can we identify some of the root causes that are contributing to some of these worker safety and health outcomes that might be particularly situated in working conditions. In occupational safety and health, we generally start with some of those physical exposures to safety and health hazards on the job. Within this approach, though, we're trying to expand that to additionally think about organizational and psychosocial factors that also make up some of these working conditions. For example, the hours worked or the shift work that people may take on, the pace of work or amount of workload, the kinds of benefits that they're offered, or the kind of breaks that people are actually managing to take. Or it may include psychosocial factors such as supervisor support or coworker norms, And all of these in many ways together create this underlying culture of health and safety at work that we're really trying to facilitate and foster through this more systematic approach that gets at some of these root causes. Within our center, we've articulated our thinking around this through this conceptual model that I've laid out here. You can see that these conditions of work that we've just seen in the prior slide are really right in the middle of the model. So they're kind of highlighted there in red as being the factors that really contribute greatly to worker outcomes, whether we're looking at injury or illness or well-being, and also to some of these enterprise outcomes such as productivity, turnover, absence, or even healthcare costs. We certainly picture health behaviors like tobacco use or dietary patterns or safety practices as being potentially a more proximal kind of a outcome that fits in here. And the evidences that I'm going to be presenting to you today really illustrates how some of these working conditions contribute both to these more proximal outcomes as well as some of these worker and enterprise outcomes that we list here. So when we think about interventions, we're really thinking about an integrated approach to policies, programs, and practices that not only targets these health and safety behaviors, but particularly focuses on these conditions of work. As Cha-Cha mentioned, what are the kind of organizational approaches that we can take to making improvements in these working conditions in order to help improve some of these kinds of outcomes at the right-hand side? What I'd like, this is kind of the focal point of our conversation today, this kind of conceptual model that, that we work with as an underlying component of the way we articulate our interventions and also shaping the research we do, and I'll present to you some of the findings from some of the things we've been doing. But to give you kind of a peek at where we're headed, I'd like to just give you an overview of what I see as our key takeaway messages based on what we'll be talking about. First of all, as we've already mentioned, these working conditions are often the root causes of poor health and safety outcomes. And improving these working conditions can actually contribute to optimizing both employee outcomes as well as employer outcomes. So what we're aiming for is this upstream systems approach that can improve working conditions and also contribute to building this broad-based culture of health within the organization. So we'll come back to this as we go on, but this is where we're headed today. So let's start out with what is it? So what are we talking about with this integrated approach? And basically, what we mean by an integrated solution is a management systems approach that is aimed at worker safety, health, and well-being with input from employees and their participation. We know that these kind of approaches must start with a solid foundation as a safe work environment, and that's really the sort of starting point of everything we do, focused on safety as the beginning point and moving towards some of these other components on the platform of a safe working environment. We build upon that on traditional occupational safety and health promotion efforts. And in many organizations, there are already a lot of activities going on in these areas. So how can we leverage what's already happening to bring some of these pieces together and actually enhance them as we look at this kind of organizational or systems level approach, emphasizing the policies and practices that can contribute to improvement in these working conditions that we're talking about, with this ultimate aim around both employee and employer outcomes. As you can see, this really aligns really closely with what NIOSH's total worker health approach is about. Cha-Cha gave a wonderful overview for this, and on the website you can see that the total worker health is defined as the policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts aimed ultimately at advancing worker well-being, using this kind of systems level approach to building organizational change to improve these working conditions. So why even take this kind of a strategy? What's the value added for organizations as they consider this? And there's a growing evidence base that you can certainly look into the Total Worker Health website for more information on some of this, or in our website at the Center for Work Health and Wellbeing. But the evidence clearly points to improvement in the effectiveness of worksite strategies to improve worker health and safety. We see a strong evidence base for improvement in the kind of outcomes that we're hoping to look at, and I'm going to illustrate some of that for you today. We also see potential for increased participation in the types of initiatives that might be offered within an organization, basically through enhancing a culture of trust. So basically, as the worker begins to recognize that the employer is also investing in worker safety, health, and well-being, there may be a greater sense of trust in the process and greater willingness to actually participate in some of these efforts. We also see evidence that this approach helps to manage cost, contributing to reduced absence and turnover, and can also help to generate revenue, whether we're looking at that through increased work engagement or job satisfaction, and even in improved market performance. And I refer you here to the little article at the bottom by Ray Fabius, who actually did some very interesting work to say, do organizations or work sites, employers who make greater investments in worker safety and health actually see differences in terms of market performance? And he found a significant relationship between the level of investment in worker safety, health, and well-being and the level of market performance of the particular organization. It's a really interesting article. I encourage you to take a look at it. This is also potentially linked to brand reputation, important for employers, not only in terms of promotion of its products or services within its customer base, but also important in terms of recruitment and retention of employees overall. So we'll come back to this, but there is a real growing evidence that the business case for this integrated approach really makes sense from the organizational perspective. So stop for a moment here and think about how this approach might contribute to meeting your own goals and objectives as you begin to think about, might this be an opportunity for your organization? How might you align your own sense of business goals, your mission, your objectives as an organization? How do they fit potentially with where the value added might actually come in? So let's take a step back and look at the evidence. What's the evidence that this will work? Where does it come from? And I'd like to start out with just a little bit of a background, a little story of how I even got into this thinking. A long time ago, one of my first studies was a smoking cessation study that I was doing in Minnesota. And one of the companies that I was working with was actually a foundry. Not quite as old school as this, but probably not that different in terms of some of the working conditions faced. And a watershed moment from my own career was a conversation with an older worker in the foundry that was participating in this study. And in a conversation with him about quitting smoking, he said to me, "Why should I quit smoking when I'm just exposed to all these fumes? It really doesn't matter." And it became very clear to me, and something that I've pursued throughout my own career and my research, is really trying to think about how workers envision the contributions of their work environment to their overall health choices. They're not separate, so that even though our thinking and the way that our functions within the work organization may look like that siloed approach in the first slide that we saw, they're actually, in the minds of the worker, very overlapping. And I think as each of us think about our own health, we recognize the ways in which the stress on the job, the work hours, the experiences with our supervisors or our coworkers may certainly contribute to many of our health outcomes, whether we're looking at sleep or dietary patterns or our own safety practices. So I'd like to give you just a little bit of background with some of this. In one of the first studies that my research team did around this area, where early on we were able to do a randomized controlled study to actually test this study hypothesis mentioned here. That is that the integration of health protection with health promotion would actually enhance the intervention impact on behavior change over and above health promotion alone. We were focusing especially here on smoking cessation, and we were working in manufacturing sites that were particularly selected because there were some types of exposures on the job that could contribute to cancer-related outcomes. This was a study funded by the National Cancer Institute. We conducted this study in 15 sites. Our process looked like the sort of study schema shown here, where we did baseline assessments followed by randomization of the companies to either receive a standard health promotion program, really usual care, but matched with the second intervention in terms of the amount of intervention provided. The other intervention actually integrated and brought in this occupational safety and health intervention. Both interventions incorporated labor management participation, but in the occupational safety piece, the occupational safety and health people were brought into that planning. The focus on management consulting changed so that the strongest component of that was really in this integrated intervention. And when we provided group and individual education for workers, the focus was really on not only the health promotion pieces, but also in the integrated group on the safety components and on the potential implications of exposures to other kind of health behaviors. What we were particularly interested in was understanding how this kind of integrated approach might actually shape the health behaviors of those people most likely to be exposed to hazards on the job. So what we thought about is that the hourly workers are really those workers most likely to be exposed to hazards on the job, and not as much so among salaried or managerial workers. The literature tells us that the quit rates are much higher in managers and more educated users of tobacco compared to blue-collar workers, where we see much more difficulty in quitting. What we see here is no difference in the salaried workers in terms of the smoking cessation rates between the health promotion only group and the integrated health promotion and occupational safety and health. The salaried workers, although there seems to be a little bit of a difference, this is not a statistically significant difference. In the hourly workers, however, we see a doubling of the quit rates. And the integrated group actually has a cessation rate that mirrors that in the salaried workers. These are quit smoking rates, not just among people who are participating in any programs, but all of the tobacco users within the companies. This was a very important study for the kind of research that my research team has been doing. It's become more difficult to do these large-scale randomized trials with changing budgets, but we have continued this line of research in other kinds of work. So in our more recent findings, we've really explored some of this social epidemiology behind this, and our research has really illustrated that health and safety outcomes share common root causes in the working conditions, really underscoring the idea that as we begin to address concerns within our working conditions, we can see benefits in terms of multiple health and safety outcomes. A lot of our work in this area is done in collaboration with Partners Healthcare, where we have been conducting the Boston Hospital Workers Health Study. This study includes not only surveys of patient care workers, and we've had a series of 3 patient care workers over about a 10-year period with positive response rates. We've also surveyed nurse managers, and we've looked at a range of administrative databases that Partners Healthcare has provided us access to. For example, not only looking at human resources data, such as what are people's shifts or their absences and other more health-related issues, but also the injury incidents, the worker compensation claims, and additionally healthcare utilization claims through their insurance database. So this has given us an incredible opportunity to be able to explore some of the relationships that we've been talking about. This slide sort of takes our conceptual model and it begins to summarize some of the findings that we've seen across our different publications, at least some of the different publications, so that you can see here that we've looked at a range of different conditions of work, from the physical environment to like physical job demands to the organization of work, including the issues like staffing or job flexibility or schedule control, as well as psychosocial factors such as decision latitude or work-family conflict and harassment. We've looked at how these factors, either separately or together, relate to a range of different worker outcomes, including proximal outcomes like sleep deficiency or physical activity or BMI, and also outcomes such as pain or work interference. What I'd like to do is to dig a little deeper into a couple of these different studies to illustrate some of this a little further. First of all, let's take a look at 2 conditions of work that we might think about in these pathways that we've seen within our conceptual model. So we could consider supervisor support and bullying at work. And what we see here is kind of a parallel influence, so that with increasing supervisor support, we see reduction in the risk of injury, increases in physical activity, and reductions in sleep deficiency. And conversely, with increasing bullying at work, we've seen increased risk of injury, decreased physical activity, increased sleep deficiency, and increased psychological distress. The message in all of this is that as we begin to modify the working conditions in this sort of systems level approach, where we're really trying to think about the sort of a broader culture of health, changing multiple working conditions or beginning to work on some of these pathways has implications across the board for numerous outcomes in terms of worker safety and health. So we're seeing kind of the potential for synergy in the improvements that we aim to make within the work organization. Let's look at this a little bit further. So in one of our analyses, for example, we explored the issue of workplace bullying, and we looked at it in relationship to mental health expenditures. So asking the question, do bullied workers have greater health plan expenditures on mental health diagnoses compared to non-bullied workers? We're really trying to understand how what the healthcare costs are, not only to employers, but also to workers. And what we found is that we were looking at 3 different types of bullying mentioned here: being ignored, being humiliated, or withholding information that one might need to do one's job. And what we saw was that with increasing numbers of types of bullying, we saw increasing mental health care costs associated with increased bullying. And if we take these apart and look at each one individually, we also see that as each one increases, we see increases in mental health care costs. In a second example that I'd like to illustrate for you, we looked at safe patient handling and mobilization and tried to understand the potential implications for worker safety and health. Part of what we were looking at here was our aim to really understand how addressing a core priority for the hospital, that is patient safety, might actually bolster worker health and safety. What are the sort of linkages here, and how can we potentially align worker health and safety priorities with other organizational priorities such as patient safety? So one of the hospitals that we were working with was about to implement a hospital-wide safe patient handling program as part of an integral or as an integral part of a safe patient handling and mobilization initiative. And we followed that through our surveys and some of our database information, and compared it to a second hospital where similar approaches were not implemented. Basically, this was an 8-month intervention, but it was a systems level intervention in many ways. It was based on large, high-level leadership support from upper management, engaging multiple departments in the organization, not just patient care. It looked at a hospital-wide safe patient handling policy communicated by upper management and with training mandated by them, but also with coordination across departments, recognizing the need for that systems level kind of cross coordination. So let me give you one example. If we're going to be promoting increased use of lifts, such as the one illustrated in the photograph here, we're going to need to have slings. And slings are a responsibility of the laundry department. They need to be delivered on time, made available across the board. And that kind of interdepartmental coordination is critical if we're going to be successful with an initiative like this. So this is the kind of approach that we're talking about when we're thinking about this kind of cross-departmental coordination. What we found here was that there was a significant improvement in the intervention hospital in terms of lifting and exertion injuries during this during the 12-month period post program, and we didn't see any significant reductions in the second hospital, the comparison hospital, really illustrating the importance of the safe patient handling practices in this intervention hospital. So just to summarize from these two studies, we see in the first one on bullying the importance of addressing the psychosocial work environment as a means of impacting downstream costs, such as the mental health care costs that we saw here. We also see the importance from a policy perspective of implementing safe patient handling and mobilization programs as a means not only of benefiting patients, but also reducing work-related injuries that might be associated with patient lifting. This evidence is carried through in the broader literature. I mentioned it earlier when we were talking about the business case for some of this work. I provided this so that you have some references here as you look in the future at the slides. But as we've seen in the literature, there's growing evidence that this integrated approach contributes to improved safety, boosters productivity and worker satisfaction, contributes to work engagement, and creates stronger safety and health programs along the lines of the bullets that are listed here. We also want to consider the special considerations for low-wage workers who are clearly a part of many of the industries that we're working with, whether we're talking about healthcare or food service or construction or other kinds of settings. The consequences of low wages are not only in terms of the wages that they bring in and the meaning of that for the quality of life for the workers and their families. But in many cases, it means having to hold down a second job and balancing the sort of strains within that effort. The kinds of working conditions are associated with the types of jobs that many frontline workers have. It oftentimes meaning fewer protections in terms of health and safety, often less job security. Many are not in work situations where their hours are highly predictable, and the benefits that might be made available to them, at least in the U.S. context, may not be as great, whether we're looking at paid sick leave, breaks, paid vacations, or even opportunities for career advancement. So as we consider these working conditions, it's also very critical that we consider the workers that we're looking at who are facing these issues and the particular issues that may come up for some workers. So stop for a moment here and think about how this approach can actually tie into what you're already doing. When we think about this integrated approach, we do not recommend that organizations sort of start all over, but really try to think about what are your own existing priorities, how can this strategy really dovetail with what's already going on, and how does it align with the priorities that you're seeing on the horizon for your own organization. We'll stop and maybe come back to this in our question and answers in a few minutes. But I'd like to have a few minutes to chat with you a little bit about implications for practice and how you may actually want to think about this within your own setting. So just a little thought exercise that we might kind of take a look at. When we think about this, we've looked at sort of the working conditions as being central here, but we suggest that for many employers, they may want to start with their own pain point. What's your driving sort of high priority pain point, whether it's in terms of employee or employee outcomes? And how might the organizational strategies or the I should say, first of all, what are the root causes underlying that? What are the working conditions that might contribute to the pain points that you see as your priorities? And then what are some of the organizational strategies, policies or programs or practices that might contribute to improvements in those working conditions? So we might consider something like reducing back injuries and related costs associated with those. One of the things that could come out of an assessment in trying to understand what are the sort of underlying working conditions contributing to those could be a relationship to moving heavy items, for example. And so with that in mind, there might be consideration giving to implementation of an effective mechanical lifting plan. So it's not necessarily that we're starting with all outcomes, but maybe starting simple and small and beginning to work up toward that larger consideration of a culture of safety and health. As we look at this, we picture several key characteristics as central to this process. Leadership commitment and support is critical and foundational in many ways to being able to articulate the priority of worker safety and health as a core component of business mission and also the objectives of the organization overall. That vision can really contribute to the formation of policies, programs, and practices that contribute to positive working conditions and really place a high priority on optimizing those through several different strategies. One being participation from workers as well as from other stakeholders within the organization. Those people who best know how those working conditions might actually be playing a role in the day-to-day experiences that workers are having. We also see a need for this comprehensive and collaborative approach that cuts across those different silos that were illustrated in the first slide and begins to look at some of the means for improving that collaborative and comprehensive nature of the work that we do. By adherence, we mean adherence to legislation, to laws, as well as to ethical standards for the kinds of ways that we provide benefits and support to the workers included. And by data-driven change, we really mean taking advantage of the existing data sources within the company to provide a more integrated way of informing priority setting, decision making, and monitoring the potential impact of the changes that are being implemented over time. Within our work, we've studied particularly how some of these factors might contribute to successful program and policy implementation. Again, seeing the importance of these leadership strategies and the leadership support. But we've also seen that companies that are open to change and innovation are oftentimes those most successful in initiating some of these kinds of changes. As we've worked with a range of companies and worked with other vendors and others who are working with companies, we see that oftentimes starting with some of those companies most ready for change might be an important starting point in terms of creating the overall business climate to be open to this kind of an approach. Obviously, there's a need for dedication of resources to this approach in order to be successful, whether we're talking about staff or staffing the effort or the budgets that might be needed. But it is possible as well to start small and scale up. As we've mentioned, it's going to be especially important to link in to existing organizational policies and practices and processes, whether we're talking about the potential existing health and safety efforts that are going on, the culture of health that's already there, and aligning with existing business priorities to the extent possible. To be successful, we also acknowledge that there are a number of challenges that could arise, and there's certainly a way of addressing some of those, partly through adequate preparation, bringing together the key stakeholders and beginning communication and planning around this together. That builds on a knowledge of your own organization, its people, and why this should be a priority to them. That means having a range of stakeholders involved, and so cutting across the different functions of the organization, each brings its own perspective to the planning process. The kind of collaborative nature of this means listening to a range of different concerns that may come up, communicating what one is doing, and certainly setting realistic expectations and timelines for the process that's being implemented. I'd like to suggest and offer to you a couple of resources that you may particularly find useful. First of all, our center has recently published a set of guidelines for implementing an integrated approach. It includes efforts to, or sort of guidance for building leadership commitment and support and fostering collaboration within the organization. There are chapters on planning and implementation of the process and for evaluation and continual improvement. We also provide a set of tools and resources such as case examples or tips, checklists. So I would encourage you to take a look at our website listed here. This is a set of guidelines that's available online to be readily downloaded with no cost to you. Thanks to NIOSH and our support from the Total Worker Health program that Cha-Cha described earlier. I'd also like to refer you to other resources on our website listed here, and we welcome you to take a look, for example, at some of the publications that are linked in here and some of the other kinds of resources that are provided there. we each year have been providing an executive continuing professional education course focused on this integrated approach, looking at work, health, and well-being, frameworks, evidence, and applications. This is a hands-on, very applied program attended internationally by a range of different participants. And we are providing this year's program in April. There's still room, so should you be interested in that, you might want to take a look at the website listed here, the ECPE program, Executive Continuing Professional Education at the Harvard School of Public Health, and we would welcome you to that program as well. So in conclusion, as we think about this integrated approach for organizations, we might consider the importance of improving working conditions as a means of adding value both to employees' health, safety, and well-being, as well as to the bottom line. This can be accomplished in part by aligning with your own business priorities and ways of getting things done, building on and aligning with what you already have in place. The starting point is with your own root causes that might be contributing to some of your core pain points, and building success in small steps, not necessarily trying to boil the ocean, but beginning small and building from that as you build a platform toward this broader culture of health and safety. That becomes part of a systems approach to build what we see as a sustainable culture of health. So with that, I thank you and would like to open it up for a broader conversation and questions, and I truly appreciate the opportunity to be participating in this program today. Thank you.
Thank you so much for your presentation. To our audience, if you have any questions at this time, please enter them into the question box on the GoToWebinar panel, and we can read those out loud. A few questions that came in during your presentation. You mentioned some very important strategies, that is enhancing worker trust to enhance the culture of trust. What practical practices have you seen that help to foster a culture of trust in an environment, perhaps in the hospital example?
I think in general, when we're thinking about a culture of health, when we're thinking about a culture of trust, we're also thinking about ways in which we can really open those communication lines so that workers begin to feel a greater sense of a voice in the work, that their own work environments, where they begin to feel and that they might actually be able to impact the priority setting that might be going on around this. Within, I can't think of specific examples within the healthcare example that I gave, although I do want to say that was an initiative that really did glean the safe patient handling and mobilization example, gleaned from a range of different inputs across the organization as a means of trying to set up something that would be successful.
Mm-hmm. In a work environment where one might be perceived as lacking in trust, are there any resources or techniques to help foster improved trust in an organization?
I kind of envision this as part of a broader strategy. So we're not necessarily, is it specific to building trust, or does the trust kind of come out of some of these broader initiatives? So I would encourage you to start as a starting point with taking a look at the implementation manual that I just presented on our website. I honestly, way of being able to say, what are some of these broader working conditions? How can we begin to create a broader culture and safety that I believe has trust as a component within that. So I wouldn't necessarily put trust in its own box, rather bring it back into this larger organizational sense of a culture of health and safety that we're really aiming to build with this broader integrated approach. Does that make sense?
Mm-hmm. And we'll definitely put the website and resources on our website along with the slides from Professor Sorensen. I believe that's all of our questions at the moment. Dr. Sorensen, is there anything you would like to add following your presentation?
I appreciate very much the chance to present this, and I would welcome you to explore some of the resources that we've shared. And my email is included on this last slide, so if anyone has additional questions, I would certainly be more than happy to have an email exchange with you.
Thank you, and thank you so much for your presentation. Lots of good information for this, and we're very happy to have you present with us today.
Great, thank you.